Schizophrenia is the prototypical psychotic disorder. Not only is it the most common psychosis, but schizophrenia tends to involve abnormalities in all 5 of the emphasized symptom domains: hallucinations, delusions, disorganized thinking and speech, grossly disorganized or abnormal motor behavior, including catatonia, and negative symptoms. The DSM-5 schizophrenia diagnosis requires persistence of 2 of 5 symptomatic criteria: delusions, hallucinations, disorganized speech, disorganized behavior, or catatonia, and negative symptoms. Here is a case example to help us better understand the application of the DSM diagnostic criteria. Gregory Baker was a 20-year-old African-American man who was brought to the emergency room by the campus police of the university from which he had been suspended several months earlier. The police had been called by a professor who reported that Mr. Baker had walked into his classroom shouting, "I am the Joker, and I am looking for Batman." When Mr. Baker refused to leave the class, the professor contacted security. Although Mr. Baker had much academic success as a teenager, his behavior had become increasingly odd during the past year. He quit seeing his friends and spent most of his time lying in bed, staring at the ceiling. He lived with several family members, but rarely spoke to any of them. He had been suspended from the college because of lack of attendance. His sister said that she had recurrently seen him mumbling quietly to himself and noted that he would sometimes, at night, stand on the roof of their home and wave his arms as if he were conducting a symphony. He denied having any intention of jumping from the roof or having any thoughts of self-harm, but claimed that he felt liberated and in tune with the music when he was on the roof. Although his father and sister had tried to encourage him to see someone at the university's health office, Mr. Baker had never seen a psychiatrist and had no prior hospitalizations. During the prior several months, Mr. Baker had become increasingly preoccupied with a female friend, Anne, who lived down the street. While he insisted to his family that they were engaged, Anne told Mr. Baker's sister that they had hardly ever spoken and certainly were not dating. Mr. Baker's sister also reported that he had written many letters to Anne, but never mailed them. Instead, they just accumulated on his desk. His family said that they had never known him to use illicit substances or alcohol, and his toxicology screen was negative. When asked about drug use, Mr. Baker appeared angry and did not answer. On examination in the ER, Mr. Baker was a well-groomed young man who was generally uncooperative. He appeared constricted, guarded, inattentive, and preoccupied. He became enraged when the ER staff brought him dinner. He loudly insisted that all of the hospital's food was poisoned and that he would only drink a specific type of bottled water. He was noted to have paranoid, grandiose, and romantic delusions. He appeared to be internally preoccupied, although he denied hallucinations. Mr. Baker reported feeling bad, but denied depression and had no disturbance in his sleep or appetite. He was oriented and spoke articulately, but refused formal cognitive testing. His insight and judgment were deemed to be poor. Mr. Baker's grandmother had died in a state psychiatric hospital where she had lived for 30 years. Her diagnosis was unknown. Mr. Baker's mother was reportedly crazy. She had abandoned the family when Mr. Baker was young, and he was raised by his father and paternal grandmother. Ultimately, Mr. Baker agreed to sign himself into the psychiatric unit, stating, "I don't mind staying there. Anne will probably be there so I can spend my time with her." What is this patient's diagnosis? Schizophrenia, first episode, currently an acute episode. In looking at why Mr. Baker meets criteria for this disorder, one must consider that Mr. Baker's case involves an all too familiar scenario in which a high-functioning young man undergoes a significant decline. In addition to having paranoid, grandiose, and romantic delusions, Mr. Baker appears to be responding to internal stimuli, such as auditory hallucinations, and demonstrating negative symptoms like lying in bed all day. These symptoms have persisted and intensified over the prior year. The history does not indicate medications, substances of abuse, or other medical or psychiatric disorders that could cause these symptoms. Therefore, he meets DSM-5 criteria for schizophrenia. Although a family history of psychiatric illness is not a requisite for this diagnosis, Mr. Baker's mother and grandmother appear to have also had major mental disorders. It's important to consider differential diagnosis in diagnosing with schizophrenia. A differential diagnosis is evaluating whether diagnostic criteria meets the standard for one diagnosis over another. For example, in this case, you may wish to consider whether the patient meets criteria for a different psychotic disorder. However, information presented best fits with the diagnosis of schizophrenia.